Hello, my name is Rachel Yates and I am honoured to serve as the Executive Director of Nursing and Midwifery and Consumer Experience at the Women's and Children's Health Network. It is a privilege to step into this role as the Executive Lead for the Friends of Women's and Children's Hospital, an organisation whose unwavering dedication and generosity leave a lasting positive impact on our entire community. The Friends of Women's and Children's Hospital go far beyond simply providing essential equipment. Their contributions enrich the overall experience for our patients, their families and our staff in so many meaningful ways. From funding specialised resources that directly improve care outcomes to supporting projects that enhance the environment with comforting and welcoming touches. Your support makes a tangible difference in the lives of everyone who comes through our doors. We deeply appreciate the steadfast commitment of the Friends of Women's and Children's Hospital. It is partnerships like these that enable us to continue offering high quality care, ensuring that everyone, whether they are receiving treatment or delivering it, feel valued, supported and cared for. On behalf of the Women's and Children's Health Network, thank you to the Friends of Women's and Children's Hospital for everything you do. Your generosity and compassion are truly at the heart of our community.
Hi, my name's Kayla. I'm the Acting Nurse Unit Manager of the Adolescent Ward. We were lucky enough to receive 4 bedside patient monitorings for cardiac monitoring with back-to-base monitoring. So this equipment is used for cardiac monitoring, and with this new back-to-base monitoring, we're able to record the data and look back on that data. This is super helpful for the nursing staff and doctors, as before we didn't have this capability. Thank you to all the friends, especially the volunteers in the shops. I'd like to give a huge thank you. This equipment has made a huge difference.
Hi, my name is Bryony and I'm the Acting Manager of the Sleep Disorders Unit, which is part of the breathing space, providing comprehensive care for children with respiratory concerns. We've got the state's leading paediatric sleep unit, performing diagnostic and therapeutic sleep studies on children from South Australia, aged from neonates up to 17 years of age. We were extremely fortunate to receive funding which enabled us to purchase 3 Centec transcutaneous CO2 monitoring devices, which provide valuable information about our respiratory functioning of our patients overnight. These machines provide continuous non-invasive measurements of carbon dioxide levels, which is essential when assessing for nocturnal hyperventilation and when titrating non-invasive ventilation. As per Medicare requirements, these measurements are essential for paediatric sleep studies. Our previous units were deteriorating such that a lot of technical intervention was required to optimise the signals. These new units are used every night we have sleep studies, and they've really contributed to quality improvement in our studies. The patients have quite a lot of equipment on them for a sleep study, and these new machines are reliable, user-friendly and have added safety features, so just make the experience more pleasant for the children. One particular benefit is that the machine doesn't require multiple calibrations overnight, so there's less staff intervention, which results in more data collected and an overall better experience. We are extremely grateful for the donations which enabled us to purchase this new equipment. On behalf of the staff, the patients and their families, we would like to thank the friends and the volunteers and everyone around the state for their hard work which has enabled us to purchase these. Thanks very much.
Hi, my name's Rosie. I'm one of the Associate Midwifery Unit Managers of the postnatal service, which includes our midwifery home visiting service at the Women's and Children's. I'm holding one of 22 breast pumps that have been donated by the Friends of the Women's and Children's Hospital across the state to our Home Equipment Centre. So thank you to all the Friends of the Women's and Children's Hospital statewide. Your donations have made this equipment available and is really helpful for all our women. Thank you.
Hello, I'm Sylvia O'Connor. I'm the Ears, Nose and Throat Nurse Practitioner at the Women's and Children's Hospital, and I'm also the Nursing Director for the Fragile Airways program that supports children with a tracheostomy in the community. I'm very grateful for the kind donations that you all have given us in being able to purchase these Liddell suction units, which are vital for enabling these children to live at home, attend kindergarten and school, and all activities that they love to do in the community. On behalf of all the staff and the children and their families, we wish to give you a big thank you to all the friends around South Australia.
Hi, I'm Sue Vanderloo, Manager for Occupational Therapy at the Women's and Children's Hospital. and I'm here to say a big thank you for these shower chairs that have made a huge difference to the hygiene for our patients in the hospital. They are highly adjustable chairs. We've got two sizes. So we've got a large size for our adolescents and a smaller size for our smaller kids. And these shower chairs are really crucial for those kids with complex disabilities that may come from any area across the state and who, even at home, may need a specialised shower chair. And it just means those families don't have to bring those shower chairs into the hospital and that we can provide them. We can fully adjust them to the particular user, and they may also be used for our kids who have had a serious illness and have been here for a long time, or for those kids that have had a serious trauma or a surgical incident where they can no longer weight bear or walk. What's really valuable is that they are really easily adjustable to the individual needs of the kids. We can adjust the foot plates if they have longer or shorter legs. We can adjust the tip on the chair if they need to have a little bit more support, need to have the hair wash where they need to be tipped back a little bit more. We can adjust the headrest, we can adjust the straps, and also we can adjust the inserts for larger and smaller kids. And as well as that, for those kids that have those special needs, they can also be used as a commode. And that doesn't seem like much, but for the kids in our hospital who've perhaps been in here for weeks at a time and haven't had a shower because they've been so unwell, just a sense of well-being and that care and hygiene from a family member or a caring nursing staff makes a huge difference. So what I want to say to the friends from all over the state, that these are such a valuable resource. We use them absolutely week in, week out at the hospital, and it means such a difference to families and to the staff. So, and mostly for our kids. So thank you very much.
Hello, my name is Dr. Pete Muller. I'm the clinical lead in maternal fetal medicine at the Women's and Children's Hospital, and it's my privilege to thank the Queen Victoria Auxiliary Service and all their supporters for allowing us to expand and improve our clinical care over the last year. Basically, for the gifts you gave us for this ultrasound probe that we use to scan women in complex pregnancies. It looks very small, but it is incredibly precise. It improves our ability to scan women with different situations, see the anatomy much clearer and precise. And by having this in our fetal medicine unit currently, it allows us to really offer a really high quality care for our patients, but also improve patient care pathways. And that's very important to us because we want our patients to do one-stop shopping. We don't want them to go to multiple places. So it allows us to be able to examine the patients with complex ultrasounds, be able to see the anatomy very clearly, precise, counsel them right then and there, and to offer follow-up care if needed, all in one place without having to go to multiple different places. In addition, it allows us to be more efficient and we can see more patients because we're able to use our two ultrasound machines that both have high quality resolution ultrasound probes. And by having this, we can use both our ultrasounds for a combination of complex fetal examinations, morphological examinations that are required to get an accurate diagnosis. So it allows us more of an efficient approach to our care. In addition, it allows us to see patients that previously we weren't able to see because we had to transfer those patients or had to refer those patients elsewhere who had what I call the better equipment that we have currently. So this has really revolutionized our service. It's become more efficient, better patient care pathways. And on behalf of our maternal fetal medicine service and all the women that we service, we would like to give our great thanks to the Queen Victoria Auxiliary Service and all their supporters and sponsors. We can't thank you enough.
Hi, my name is Kira Alicio and I'm a senior critical care physiotherapist here at the Women's and Children's Hospital, working in the Paediatric Intensive Care Unit. This is the Pegaso machine that's donated to us from the Friends, which is an intrapulmonary percussive ventilator, or IPV. This means it provides percussions as the child breathes in and out through the machine, helping to move secretions from their lower airways up to bigger airways to be coughed out. We have used the machine on about 3 or 4 patients now and have had very positive feedback from both the kids and their families. One child called this his motorbike and would often ask in physio sessions to go for a ride on his bike. And another little boy referred to it as his choo-choo train. During physio treatment with the Pegaso, we have also found really positive impacts with improved secretion clearance with the children and also improved oxygenation during and after treatment, which is going to help their lungs recover and get them out of the paediatric intensive care unit a lot quicker, hopefully getting them home to doing what they love with their families sooner as well. So we would like to say a big thank you to all the friends all over South Australia for their contribution to donating this Pegaso machine to us, and also all the other amazing contributions they make to children and their families here. Thank you.